Let's talk about the serious harm that happens when dissociative identity disorder gets misdiagnosed. This quote nails it. You can't just cure switching with breathing exercises. It's not that simple. So why does this happen? Well, it often starts with the clinician's own fears. Clinicians are terrified of looking foolish, or worse, getting sued, so they avoid the complex DID diagnosis. And this fear leads to defensive charting. Basically, it's just about covering their own backs. So a patient explains their reality, but the doctor just writes down delusional content. See the disconnect? So a real trauma response gets relabeled as just bad behavior, and that simple switch changes everything. Look at this. Switching becomes mood swings. Amnesia becomes lying. It's a total misinterpretation. This quote shows the flawed thinking that switching only happens when someone is dysregulated. And that wrong diagnosis leads to a really messed up intervention. It's basically a trap. Take DBT diary cards. You're supposed to track your feelings every day.
Sounds simple, right?
But with DID, amnesia means you literally can't remember. Different alters are out. The task is impossible. But instead of seeing a symptom, the therapist just sees a patient who's not even trying. And here's the core denial. The therapist thinks they're talking to the same person every week. So it becomes this catch-22. You can't get therapy until you do the impossible thing. And the biggest cost? The actual trauma. It never even gets talked about. All this critical work, like system mapping and internal communication, it just gets ignored completely. When you just force the system to act normal, you're actually blocking any real path to healing. So it makes you ask, if the therapy punishes the symptom, how can anyone ever get better?